Good afternoon, guys, and welcome to the podcast. I've got a New York City physical therapy practice owner and coach here with us today, Stephanie Telibasa. She's also stationed in Florida, and she helps clients that are looking for physical therapy, but she also helps practice physical therapy practice owners as well. She's got a community and a membership, which is really interesting to see how she's leveraged her strengths and skill sets. Stephanie, welcome.
Thank you for having me, Chris. That was a great introduction.
Yeah. Briefly introduce yourself and we'll get right into the questions.
Yeah, so I'm Stephanie Telibasa. I'm the owner of House of Physical Therapy in New York City. We have two locations in Manhattan and in Brooklyn. And then I also run a membership community for physical therapists who are starting their own practice
Mm.
and looking to stay in the one-on-one model.
Yeah. And what got you to think about your practice in that way? Because a lot of, doctors or even lawyers, they're listening to this and they're like they have a practice or they have what got you to think to run your business this way?
Yeah. So I think when we start out and in healthcare, usually our why is because we want to help people. We want to work one on one, see the change with each patient. So if you would have asked me when I opened my practice in 2017, I would be doing patient care forever. But what kind of happens is you realize that you can impact more people if you spend your time supporting and training other physical therapists. So when I realized that it was really hard to find a practice that allowed for one-on-one care. We do 45-minute sessions. There's no aides. It's just us in the treatment room. When I realized that there really wasn't anything out there like that, unless you opened your own practice, I really started thinking about, okay, how can I open this up and create jobs for other people who want to practice this way? And when I did that in 2019, and I started to slowly take a day off for the first time in 2 years. And I started to realize patients were getting just as good, if not better, results working with someone on my team. That slowly changed my mindset. And throughout 2020 and 2021, I started removing myself from patient care and really spending my time growing the practice by bringing on other people who are super passionate about healthcare.
Mm. Interesting. Because, like I said, a lot of the people in healthcare listening to this, they're so used to starting out as because you started as a PTA or they're doctors or just like trading your time. What got you to start thinking more broadly? And was it like for me, it was 9/11 and it was 2008 and luck and seeing like where the world was headed. You really couldn't trade your time for money anymore. So, what was it for you?
Yeah. So I'm going to cite 2020, but not for the reason that most people are going to think.
Mm.
So actually, February of 2020, so before kind of everything shut down, I was having dinner with my new mother in law, and she affectionately fluffed my hair and realized that I had a quarter size patch missing. And this was February. So I immediately blamed it on my snowboarding helmet and was like, oh, the Velcro must be off. And when I started to analyze my lifestyle, it's interesting. As a healthcare provider, I wasn't following any of my own advice. I was skipping lunch to take an extra patient. I was going into the city at 5:15 a.m., commuting home on the 9 o'clock train, skipping the gym, not eating, right? And I actually developed stress alopecia and I was losing hair at 28. So I really slowed down and started to think, okay, if I have this other physical therapist who patients love, and I'm not required to be there, right? The only person making my schedule is me. What if I step back even more instead of working 60 hours a week? Can I work 40 hours? Can I work 30 hours?
Yeah.
Right? And that's what really started getting me to think about balance and implementing some of the things that we teach patients to do.
Hmm. Wow, that's yeah, interesting. Talking about so you again you transitioned from being a hands-on clinician to running a practice remotely, and what strategies help you scale while maintaining quality patient care?
Yeah. So definitely important to note that I did this in stages, right? I didn't just all overnight move to Florida and leave my practice by itself, right? The first time that I didn't go in, I realized, hey, I'm the one who's cleaning the bathrooms. We probably need to hire someone to do this. So you remove yourself in stages. And then as you start to not only delegate, but implement some systems so that there's stability, even when you're not the one doing all of the things, wearing all of the hats. And that's what I help practice owners do now. I help at that point when you're maxed out on patient care and also wearing all the hats. Okay, what do we do? Because there are no systems. So I help you implement those systems. So, really, that's what allowed me to stop coming into the office and still have things run as efficiently, if not better.
Hmm.
And that also comes from trusting your people, right? Trusting that I always start with the default that everyone wants to do a good job. Everyone in healthcare gets into this field to take care of people. And if you default to they want the best outcomes for their patients, it really takes a lot of pressure off of micromanaging and trying to control every little thing.
Yeah. Yeah, really fascinating. And I had because I did the same thing. We'll talk about telehealth, but
Yeah.
I did it with just building different businesses that provided side income. And I had a guest on. Her name is you remind me of her is Dr. Brooke Choulet, and she's a psychiatrist out of Arizona. And she was actually during residency and fellowship, she built up a psychiatry practice where she was a business owner, and she'd hire instead of physical therapist. She was hiring psychiatrists, and now she's doing very well. The so talking about building and growing a private practice, what are non-traditional marketing strategies that have worked for your practice? Because when I talk to business owners, they're all like, "Oh, I got a marketing agency," and I'm like looking at the rates, and they're just outrageous. And so, how do you market your practice?
Yeah. So I think some of these marketing strategies, I'm going to say this word and you're immediately going to have a picture of what that looks like. So, word of mouth is always the first, right? Your initial patients love you so much, they tell everyone about you. Your initial referral sources start to send you patients. But word of mouth can actually be calculated, repeatable, it can be systematized. So, I've taken that word of mouth strategy and figured out some numbers and formula of okay, how many leads do we have to see in order to get the amount of new patients? How long does a typical new patient stay with us? And if we start to look at the data, then we can back into which lever do we want to pull for marketing? Is it that we need to improve our search and we need to put some keywords in different places? Or is it that we need to collect more reviews? I think an interesting kind of story on that, catching the patterns and looking at the data. When we opened our second location, immediately one of our someone on our admin team who answers the new patient inquiry said, "Oh, I think that the demographic is different in this new location. We have to lower our price because a lot of people are saying no to the price." Right? So we're out of network and self-pay. We take insurance, but at the out of network level. She said, "A lot of people are saying no to our price, so we have to lower it." I said, "Hold on, let's zoom out. Let's look at this. We don't have any referral connections in this new neighborhood. We don't have any testimonials. We have no Google reviews. Of course, they're saying no to the price. It's not because we're too expensive and they can't afford it. It's because they don't know who we are and our brand and our reputation isn't built yet." And after a couple months and getting the Google reviews up, all of a sudden it's not too expensive and people are saying yes. So I think, when we talk about marketing, I always want to look at the patterns before just saying Google ads is the best thing or Facebook ads is the best thing, because you really have to see what's working for your specific neighborhood, clientele, all of that.
Yeah, interesting. And obviously you're on this podcast is another form of new form of marketing. And what role does social media play and interviews and all of that play in your marketing and patient acquisition?
Yeah. So for me, I will be completely transparent with you. The reason that I've been working on guesting on interviews is because I wanted to practice having recorded conversations and see if I could get better at public speaking. But a side effect of that is every time you're on a podcast, you get a backlink to your website. And we know backlinks help with SEO. It creates like a spider web. So the more backlinks you have, the more strings in that web. So the stronger your website will pop up. So that's a good side effect. As far as social media, we just started a social media strategy in the fall of 2024. So we're maybe 4 or 5 months in. Prior to that, it's all been typical SEO, unpaid. I've never done paid marketing for my practice. But social media, what's interesting is we have actually noticed we haven't gotten any patients from it, but we have started to get 2 physical therapy applications per month that have found us through Instagram. And they're saying things like, "Oh, your Instagram makes it look like such a fun place to work." And it's just such an unexpected but obvious side effect.
Interesting. Yeah, just because you're marketing and you attract different, and it's really interesting to hear about the unexpected ways that social media marketing. Because sometimes it's not that post that you put so much. It's a kind of like that post that was just little, and then it just blows up. It goes viral. The other, and I've also had a lot of concierge doctors come on, and so you've helped both insurance and cash-based clinics grow, and obviously insurance is the painful way, but and what are the key differences, and how should a PT practice owner decide which model to pursue?
Yeah. So the commonality in the physical therapists that I help is that they all want to treat one on one. So whether they take insurance or they're cash based only, they're seeing one patient at a time for a minimum of 45 minutes. So that's like the requirement if I'm going to help a practice owner. But as far as thinking about if you should take insurance or cash based, there's pros and cons of both. The insurance based owners ask me, should I add this cash service so that I can increase my revenue? And the cash practices say, should I accept just one commercial plan so that I could get more leads? I'm like, both of you are thinking the grass is greener on the other side. So I think it's really about the model and where you want to spend your time. So with insurance, you might be spending a little bit more time rallying for that patient to get their visits medically approved for medical necessity. In a cash-based clinic, you might spend a little bit more time on marketing and changing the public perception of what physical therapy is. Why can't you use your insurance here? So there's no right or wrong, and I wouldn't say it's exactly 50-50, but it's a pretty even split of who I've helped, and I don't see, "Oh, this is the right way to do it."
Mm, interesting. Yeah, I know a lot of doctors. Obviously, there's a lot of backlash against insurance. So I know a lot of doctors, they just stop working with insurance. It's just so painful, and they get ripped off and not compensated for their efforts. Yeah. I'm sorry. You were gonna add something.
No, I agree with you that there's a big push right now to stop accepting insurances because the hopes are if all of us stop, then insurance companies have to change our contracts, right? It's not some of these contracts, they're paying less than what we would pay a physical therapist for that hourly rate. And then we get into situations of, okay, then we have to double book, otherwise we can't eat. So I think something, as far as when we're looking at that insurance piece, something that I think I really drive home with all the owners I talk to is we don't want to pass that frustration to the patient. So even if you're cash based, even if you're not accepting the insurance, can we understand the insurance enough that we can explain to a patient how to look up their out of network benefits, how to look up if they'll be reimbursed directly for the session, what portion can they expect back? So if they pay us up front cash and I give them a super bill, can I give some instructions to that patient to at least help them out and not just say, "Oh, no, I don't take insurance. It's too much of a headache." Because then we're passing the headache on to the patient and right. Causing more stress does not seem like the answer.
Yeah, it's like shelling out $30,000 for a hip surgery, or even, and I know at MD Anderson, there's a lot of wealthy people that come from China and Dubai, and they actually pay in cash for their medications, like sometimes tens of thousands of dollars. They just pay because the moving on industry trends and the future of physical therapy. Obviously, you have this membership site where you coach business owners how to your approach to growing and scaling a business, which is really interesting. Where does telehealth come into the future of physical therapy? How has it changed? How is it used? Where do you see it headed in the next 5 to 10 years?
Yeah. The way that we use telehealth at House of PT is a little different than your teledoc on the back of the insurance card. I had a funny situation where a patient thought that it was like calling the teledoc on the card, and they showed up at their desk in a suit. And I was like, how am I supposed to look at your knee? We use telehealth. It's a Zoom session. You lay on the floor. We're looking at you on a yoga mat. We're watching you walk. You're exercising. You're doing all the same things, except we're not doing the hands on portion, right? Obviously, we can't. We haven't figured out how to massage through Zoom yet, but well, that's been a really helpful tool in New York City because a lot of our patients travel or they have summer homes and they might not be local to the city all year round. Where I see it moving into the future of the industry is more in this hybrid approach where we have in person sessions. There's a lot that you need to appreciate when it comes to the human body, seeing someone in person, palpating their muscle, feeling how their joints move, and then having this complement of they could potentially go to the gym and record themselves. We can give feedback asynchronous. They call this remote therapeutic monitoring. So there's some sort of technology where we're communicating on their plan. It's increasing their compliance, right? They're more likely to stick to the plan because we have accountability. So that's where I see the future of PT is this hybrid approach of digital care mixed with the in-person.
Interesting. Yeah. It's like you're talking about the remote asynchronous monitoring, follow-up visits, like surgeons, we used Zoom to look for wounds. And the next question I have for you is I'm not sure if this applies but how do you see AI coming in and helping you with your practice, either growing and scaling, marketing, or just patient care? How are you thinking about AI?
Yeah, so far, so I went to a big physical therapy conference in the fall, and most of the EMRs, so the software for charting, has started to integrate AI. So when the patient fills out their intake forms, it can summarize the intake forms, put it into the evaluation note. So anything that it can do to make documentation faster, I am for. So far, I haven't seen any of the dictation services be accurate. So I don't know. I don't I think that part is still learning, but some of the things that the EMR companies are doing are really cool for time saving because we want to spend the most amount of time facing our patients and not facing a screen writing down what we're doing. So I definitely think it's being incorporated. As far as marketing, I think what I'm okay with is when we use it for ideas, when we use it for maybe like spell checking or a first round draft, like an outline of a marketing campaign. But the problem is when you use it to actually create a social media post and then you're putting that out there, whatever you write or say in those social media posts or in your blog post, that is going to attract people to your practice. So if someone else is speaking for you, whether it's AI or a marketing agency, you're outsourcing it, are they going to have the voice that you want to attract, right? For House of PT, we'll take our patient reviews and whatever they say they enjoyed about working with us, that's what I put out there in our marketing. I will just echo that voice. If they say, Dr. Chris listened to me and made eye contact while I was telling my story. That's what I want to highlight. I don't know if AI can pull out those things or if it just becomes a generic physical therapy marketing campaign.
Yeah. Yeah, there's going to be a lot of different use cases, especially in the marketing realm, the software automation, delegation, and then how it will be interesting to see how you can use it in conjunction with clinical care, like diagnosis will be
Mhm.
really interesting. It's a technology, it's a tool, so it's going to be really interesting to see how creative people get. Rounding it out, you mentor PT students, practice owners. What common piece of advice do you give yourself? Do you find yourself giving to those looking to go into the industry, to grow and scale their business, and just kind of balance business and passion?
Yeah. I think where I'll start is that we are always going through cycles of learning. And I think as it's definitely a shared trait for physical therapists. We want to be perfect. The first time we evaluate a patient after school, we want to be perfect. We want to be so thorough. And I think confidence comes from knowing that you don't have all of the answers. And if someone's been in pain for 6 months to a year, you're not going to be able to solve that pain in 45 minutes the first time you meet them. Right. So we don't have to have all of the answers. And then where that comes up later on is when that physical therapist goes to open their own practice, they don't want anyone to know that they don't know what they're doing. And they try to make it perfect before they announce or tell anyone. And I think what we've seen on social media, specifically on TikTok, is people want to see the messy journey. They want to see from day one when you thought of the idea. They want to see when you messed up, when you ordered the wrong thing and now your equipment doesn't fit in the room. They want to see that and feel like, oh, they're a human too. That's approachable. That's so I guess the overall summary is no one knows what they're doing and you have to just start and practice and be okay with failing in public.
It's funny that you mentioned TikTok, and but it's actually people go on the TikTok and Instagram and to actually get it, they actually get go there to get information, and that's how you. So it's really interesting. And how can people find you and check out your work and reach out to you, join your community, and so on?
Yeah. I talk a lot about business on the Planning PT. So the handle is just the Planning PT on any social media account. And I tell you all the messy behind the scenes stories on TikTok. So if you like hearing how much I've made mistakes, that's where to go. And then for physical therapy, that's House of Physical Therapy.
Yeah, excellent. Thanks so much, and I really enjoyed talking with you. And keep up the great work.
Thank you for having me, Chris.